Since 1954, Terrebonne General has been a beacon of health and hope in our community. As we mark 7 decades of dedication to your well-being, Terrebonne General Health System remains committed to advancing healthcare, improving lives, and expanding our services to meet your evolving needs. In celebrating our past, we look forward to a future filled with promise and progress. Your health is our legacy. To discover more, visit tghealthsystem.com.
The Foundation's excited today to be able to partner with Terrebonne General and CIS to provide free cardiac screenings to our community. We have about 70 people who are signed up to be able to participate in the screenings. You know, our goal today is to be able to help our community and help our community stay healthy. And this is just one of the many ways that the Foundation and Terrebonne General and CIS are fulfilling that goal.
The value of these screenings is picking up on diseases that you otherwise may not know you have or may not find until you actually have symptoms of that disease, at which point it can be somewhat harder to treat that. So finding early symptoms or markers of disease that you otherwise may not know you have. So there's a few things that we're looking at today. We're going to be looking at cardiovascular health, so at the heart in general. We're also going to be looking at screening people for leg disease, and that includes both disease in the arteries and the veins of the legs. When we're talking about heart disease in general, the most common things would be chest pain, shortness of breath, especially when you are doing some type of activity. However, most of the time when you're having those symptoms, it is already pretty late in the game. We're looking today for changes on tests such as EKG, such as blood pressure abnormalities, such as cholesterol abnormalities. When we're talking about the legs, simple things from vein disease would be seeing varicose veins on your legs, seeing discoloration on your legs that's abnormal or wasn't there several years ago. And from an artery standpoint, we're talking about things like pain in the toes, pain in the feet or open wounds on the toes or feet, as well as pain when walking. Finding these symptoms early is important because, as mentioned, if we catch this later in the game, there can be dire consequences. So people can suffer from things like heart attacks, for instance. People can suffer from things like open wounds on the feet or on the legs, which in a worst case scenario can turn into potentially having a toe or a foot cut off in the future. Finding these things early can prevent those types of situations. You don't need a referral in order to see a cardiologist. That's a pretty common misconception that a primary care physician or another physician would have to refer you, but that's not the case. You can call our clinics directly and we can set you up with a physician, nurse practitioner, or a PA to take a look at some of the concerns you have.
Hi there, I'm Dr. Matthew Finn here at CIS and Terrebonne General. We're doing the health screening here at the CIS clinic in Houma. We're happy to provide the screening service to the community to improve the people's awareness of their health. We're doing blood pressure, EKG, some basic labs, and thermal imaging of the legs to look for varicose veins. So thermal imaging gives us an inside peek into the varicose veins, can give us a look at some more subtle varicose veins, which may represent propensity to develop worsening varicose veins, the propensity to develop ulcers, leg pain, cramps, and so on. These symptoms are extremely common, much more common than almost anything else in medicine. Varicose veins is extremely prevalent, and it can be difficult to deal with. And we're here at CIS and Terrebonne General to help our patients treat this difficult condition. For the signs and symptoms of varicose veins, most common would be swelling or painful visible varicose veins. You can also get restless leg, numbness in the feet. You can get redness over the veins, which may represent local inflammation. As for the treatments for this, the standard is elevating the legs at the end of the day, wearing compression socks are the primary therapy. If these conservative therapies don't work, there's other minimally invasive treatments that can be provided to help alleviate some of the symptoms. If you come for a regular office visit beyond just the screening, we typically do an ultrasound, a very in-depth ultrasound to see how the valves inside the veins are working, look at both the deep system of veins and the superficial system of veins, and discuss different options for treatments to improve your symptoms. So if varicose veins are not caught early or dealt with, They can, over time, develop into swelling in the leg, discoloration. It can be a purplish or reddish color can develop, hair loss, and even ulcers in some of the worst cases. So we're here to help prevent that. So if you have any concern for your varicose veins, please come in and get a check.
Today at the screening, we are doing in-body scans. So it's a body composition analysis that can tell us how much body fat, muscle mass, calories you burn, and water that you have in your body. So healthy weight is very important for a number of things. We have a bunch of risk factors that weight contributes to metabolic syndrome. And so especially at today's screening, we are checking for blood pressure and cholesterol, and a lot of those are things that food and nutrition has effects to it. So when we do these in-body screenings, they can tell us, if there's an area that we need to improve for overall health as well.
Part of the screening today is also to monitor blood glucose, which can detect diabetes. Diabetes and heart disease are linked together. Things that we offer and educate at Terrebonne General is we provide diabetes education and also weight management services. Education is key to managing diabetes. We provide a comprehensive diabetes education program at Terrebonne General. Healthy eating is a part of that program, along with monitoring blood sugar, taking medications. It's important for patients to understand what diabetes medicines can do for them, and that eating is very, very important. Healthy eating is very important to manage diabetes as well. Something else that today's screening can monitor for is prediabetes, which is you're not yet at the diabetes level, but you're headed there. And so we can kind of halt it in its tracks with a little bit of modifications like diet and exercise. The participants were encouraged to come fasting, and so when they receive their blood glucose level, it'll be able to tell them kind of where they're falling, if they're in the normal range, prediabetes range, or possibly even in the diabetes range.
Today's social media segment is brought to you by Alford and Associates for all of your insurance needs. CIS, Cardiovascular Institute of the South, the highest quality cardiovascular care available. Barker Honda, the Barker family tradition of quality.